So here we are with Kathleen, and we've already completed the consultation. What we're going to do today is a total face rejuvenation process. So we're going to use Perlane, Restylane, and also Disport. And Kathleen's main areas of concern, if we look at her, are some deeper lines between her eyebrows in her forehead, some around her eyes, a little bit along her jawline, and then also some lines around her mouth. So she's nice and numb. I just did a nerve block, so she's probably not going to be talking during this procedure. We're going to do the Disport first and then the filler. All right. So first thing we're going to do is treat the glabellar region here between the eyebrows. Then I'll move on to the forehead and then around the eyes, and this is all being done with Disport. Good. Big breath in and breathe it out. Good. And one more frown for me. Good. And big breath in and relax and breathe out. Good. Turn this way a little bit more. A few little pokes here left. Doing so well. I'm not going to go too heavy around your eyes just because you haven't ever had it done. That's the one area that can slightly change your natural expression. So I like to go pretty natural around the eyes. So the next thing we're going to do is a neurotoxin neck lift, basically. It just helps show the contours of the lower face a little bit more. We're targeting kind of the upper neck and the lower face muscles, and it kind of has this pullback motion when it's done correctly. So look straight ahead here. Good. Doing so well. Just keep breathing. These may be a little tender, but you're doing really well. So well. So Kathleen has tolerated all of our Disport injections, and now we're moving on to the dermal fillers. We're going to start with some Perlane. Perlane's a little bit of a thicker filler, so it's a really good volumizer. So for her, I'm just going to put a little in her cheeks. When I do that, it actually lifts the whole face. So we're going to put a little in her cheeks, a little in her lower face, and then we'll move on to her lips. You'll hear some funny noises when I inject those, so don't worry about those. Nothing unusual. Sometimes some air bubbles in here.
Mm-hmm.
Beautiful, huh?
It's like pop rocks.
Yeah. Yeah, it is. Big breath in and breathe it out. Beautiful. Alright, so right now I'm just checking for symmetry, and I always look at this angle just to make sure her cheeks are even. I finished on the upper portion of this side of the face. As you can see, her cheek looks a little more lifted. I put some filler back here, and she'll notice in the next couple of days her lower face kind of looking like it's more pulled back. Now I'm going to come to the other side and finish off her cheek and also the lower face here so everything appears pulled back. Your face is kind of feeling really numb, huh? It's hard to move it around.
Just a little.
Filling in really nicely. It's neat because we get these kind of contours in the back, in the back of our face, and you know, they're kind of like a forgotten area.
Right.
And it's lost volume, so when we replace that, everything kind of goes to its proper, ends up in the proper spot. So we filled in the upper portion of her face, which I'm really happy with how it looks so far. It's a little swollen, it will come down. Now we're going to move on to the lower portion of her face and her lips. Usually I like to get the lips kind of out of the way because they are the most uncomfortable area to treat. I'll do those first, and then I'll kind of work my way down. As you can see, kind of pay attention to her lips now. She's told me she's lost some volume. So we're going to replace that volume, and we're going to try and help minimize the lip lines around her mouth. Breath in and breathe out. Doing really well. Big breath in and breathe out. When you feel.
Mm-hmm.
Good. So I'm just kind of enunciating the vermilion border, the line kind of around the mouth first. And then we'll actually go and give her some volume. Now I'm going to add just a little bit inside the pink of her lips, and that will actually add the volume to her lips. And breathe out. Pinch. Breathe it out. And big breath in and breathe it out. Beautiful. We're going to start working on the bottom lip now, just adding a little volume and also helping to decrease the lines around her mouth. Good. Big breath in and breathe it out. Perfect. Oh, beautiful. Doing so well. Good. Watching those lines disappear. This is your less sensitive side. Seems. So we've finished with the lips. I am going to see her back in 2 weeks just so we can make sure that everything looks great, and if she needs any refinements at that point we can do it. The next area I'm going to move to is just the lower portion of what's called the nasolabial fold. A lot of people call these the smile lines. In my practice, I don't like to fill in this area too much. I feel like it makes the face look too forward. And I want to just focus in on the lines on this side, and that will just give her a little bit more of a youthful appearance. After that, we're going to move down here and even put a touch in her chin to bring her chin down just a touch. And open. Ah. Just a touch. Tiny poke. Okay, so the last area we're treating is what's called the mental crease. This is a muscle down here, and with age it wants to come up and in. So what we'll probably do is a combination of a little of the Disport to bring it down, and then I'm just going to put a little bit of Restylane into this area to fill it out. Big breath in and breathe out. This pinches just a touch. Good, I'm going to do the other side. So as part of the treatment, I always massage the filler, and it's almost like sculpting the face. Wherever I put the filler, I want to make sure it's lying smooth, and I always do it in kind of an upright motion just to make sure we're telling those muscles and that filler to keep everything upright. It's also kind of relaxing for the patient after they've been through hundreds of injections. I usually massage with just a little bit of arnica. Arnica is a homeopathic ointment, and basically it helps with bruising. It also helps with swelling. So I have the patients actually take it orally about a week before I do the injections, and then a couple days after, and then I put it on, like I said, topically, just to help them right after the treatment. We're going to see her back in probably about 2 weeks, just to make sure everything looks good and the procedure went well, and then to add any extra areas or do any refinements at that point. Okay, so for a final breakdown of what we did, I used a total of 4 syringes. On Kathleen, I used 2 Perlane and 2 Restylane. I used the Perlane in the upper face to give more of a lift, and I used the Restylane in more kind of mobile areas around the lips, so her lips are nice and soft even after the filler. I also did Disport injections, and I did them along her jawline. I did them in the complete upper face. And I did a little bit in the chin, also known as the mentalis muscle. So we will see her back soon, but you look fantastic, and she doesn't look beat up at all. She looks great, like she can go about her day with confidence.
Absolutely.
Here we are 2 weeks later with Kathleen, and before, when she was here, we did Disport in the whole upper face, a little bit along the jawline, and we also used 4 syringes, 2 of Perlane and 2 of Restylane. So just looking at her face, I'm so happy to see her back, because she just looks even more gorgeous than before. And what I noticed specifically is that rather than her face being more of a square, it's kind of transformed more into a heart-shaped face. So that youth we kind of gave her back in her cheeks, and her jawline is much more smoothed out. And overall, her face looks brighter, and she looks well rested. And any comments? Are you just kind of feeling good?
Like I said, I'm really happy with this.
Good.
And having an upper lip again is kind of nice.
Oh, good.
So,
Wonderful.
yeah.
Good. Well, we'll see her back in a couple months for another follow-up, just to make sure everything is holding up.